Hey guys, I want to do a quick video about sterile tubing changes. I thought it would be beneficial to actually see the sterile tubing changes rather than just reading it off of a poster. I think it's helpful to see step by step what we do for sterile tubing changes and how we maintain sterility, and also hear me walk my way through it. And I'm also going to talk about what we do before and after. So the first thing that I would do for my sterile tubing changes is make sure that my new sterile TPN and lipids is up from the pharmacy. That is once a day, usually at 1500 on the MAR. So I try to coordinate that with my care times for babies, and you also want to try to coordinate that with any other breaks to the line, like if you have medications, if you have a heparin flush, do it too. You want to do that at the same time as your sterile tubing change. So we're trying to maintain sterility, and we're trying to break our central line the least amount of time so that we lessen the chance of an infection happening in that sterile line. So besides making sure that my new TPN is up here, I would take all my supplies that I need into the room. I'm going to go over those in just a second. I'm going to ask my family to step out if this is a central line, because it is a sterile procedure to do a sterile tubing change on a sterile central line. So I'm going to ask my family to step out briefly. I'm going to put my sign on the door that it's a sterile procedure, put it on the door, and then close it. I'm going to have my second RN in here to help me verify the new TPN and lipids, and also my rate. And then also if my baby is in isolate, my second RN can be the one to hit my air curtain button, and then also open the door to my isolate if I have a second RN in here. If I don't, then I'm going to make sure that I have 2 pair of sterile gloves. That way when I'm all the way sterile, if I don't have anyone in here to do that for me, I can take off my sterile gloves, throw them away, hit the button, pull my door down, and then put on my second pair of sterile gloves and finish my sterile tubing change. So all the supplies that I'm going to need in here are my PPE. So I'm going to need my mask, my hat, gown, 2 pairs of sterile gloves, clean gloves. I'm gonna need to flush. I'm gonna need my lipid tubing. I'm gonna need my clear adapter for your flush. You're gonna need 4x4, sterile 4x4s, and alcohols. I would say 4 to 6 of each, just because it's nice to have a couple extra. And I'm also going to have my purple wipes to clean my area, and I'm going to have my buddy in here, and then I'm going to have my OR towels also. So I think I have everything in here. So the first thing that I would do is get my new TPN and lipids. This is my old bag. This is my new TPN and lipids. If I have it right here, I have it hung up right now to save time, but I'm gonna have it right here. My second RN is gonna be in here at the MAR. I'm gonna be here at the baby. I'm gonna verify the baby by their name and date of birth, and verify this is the correct patient and this is the correct medication. Then we're gonna verify all the components of the TPN individually, line by line. Then we're going to verify the rate. Then we're going to do the intralipids behind that and the rate with that. And once we double co-sign that, if we send those details over to your pump, so my pump is still running with my old TPN. If we send those details over, because we've double verified, we are going to confirm it, and then we're going to stop or put it on standby, because we are going to switch the cassette over and then start it once we have our new TPN. So I've already verified everything. Before I would take my TPN out of the bag at all, I would put Curos caps on all the endings to make sure that we're not introducing any infection. So first thing I'm going to do is get my hand sanitizer. I'm going to get some clean gloves on. I'm going to take my purple wipes and clean this area really well. Normally I let this dry a little bit longer, but for time's sake, I'm going to try to keep this video to the main points. Because you see, you want it all the way dry. All right, I've thrown that away. So now that I have done that, I'm gonna take these gloves that clean that area off. I'm gonna hand sanitize. I'm gonna put on a new pair of gloves. I'm gonna drop everything onto my sterile field and prepare that sterile field. So when I get my OR towels, I'm gonna pick them up on the outside edge. That way I am not touching the inside. That is gonna be my sterile field. So, going for time here, not perfection. So, all right, got my sterile field right here. Picking up my other OR towel on the outside corner. I'm gonna put this one over my baby, and over this area I'm gonna be doing the sterile tubing change. I'm also gonna put my old line on top of that sterile field in the corner. All right, so then I'm gonna drop all the things on my sterile field, which is gonna be I'm gonna open this up and put my lipid tubing there. I'm gonna put my adapter on there. I already opened these just for time's sake, but I would open up all of these individually, the 4x4s, and put the sterile 4x4s and put them in a pile. I also already opened up my alcohol pads. You open up one by one and put them on your sterile field, and I like to put them in a pile so that they stay moist for longer. And then you also need your flush. Your flush, I like to go ahead and open this, take the top off, and then get your little air bubble out. And since this is not sterile, I'm gonna put this on the outside edge of my sterile field, not touching anything else. I'm also going to get my lipids that were in my sterile tubing, the new one. So I have my lipids that I've already verified, and I'm going to take the top off of that and throw it away, get my air bubble out all the way to the top, and I'm also going to place that on the outside edge of my sterile field, not touching anything else. All right, so now I'm going to my new TPN. I have hung it up, I have it here, and I'm going to take the end of it. I'm going to prime all the way to the end, and once I have primed all the way to the end, I'm going to stop it right here at the cassette. I'm going to take the ending off and throw that ending away, and then I'm going to put the end of my new TPN and lipids on to my sterile field. So I'm going to put it in a way that it's not going to pull it down. All right, got that on there. So I verified my TPN. I have my sterile field here and here, and my trash can is readily available. And now I am about to do the sterile portion of the sterile tubing change. I'm going to take these gloves off. I'm going to hand sanitize. So I'm going to put on all of my PPE, and my hair would be up. I'm going to put on my hat. My mask. When I go to put my sterile gown on, I'm going to open it up carefully. I'm going to try to make sure that when I open this gown up that I am not touching anything else, and I'm only touching the inside, not the outside sterile part. If I had a buddy in here, I would have that buddy go around the back and finish putting my gown on, and I don't currently have a buddy, so we're going to make do. Alright. quality. Okay, I have my gown on. I'm gonna put my sterile gloves on. For time's sake, I'm going to put clean gloves on, but as of right now, I am putting on sterile gloves. All right. So now I'm sterile. So the first thing that the steps have us do is take a sterile 4x4 and pick up the new TPN and lipids tubing, and then take a alcohol pad and clean it for 15 seconds. All right, and then I'm gonna let it dry. I'm gonna be careful and throw this away. So the next thing that I'm gonna do is prime my lipids. So my lipids are on the outside, although my lipid tubing and my adapter are both sterile. So as in, I'm sterile, they are sterile. I can touch sterile things. I just can't touch non-sterile things with my sterile gloves unless I have the sterile 4x4. So what I'm gonna do right now is take off the little adapter of that, the end of the adapter, and throw it away. And then I'm also gonna take my sterile tubing and get this off and get off both of the endings off of that. Makes it a lot easier because that ending is hard to get off. Okay. Okay. All right, got both of those endings off. All right, so I'm gonna take my sterile 4x4. I'm going to grab my flush, and I'm still sterile, and I'm touching this adapter that is also sterile. I'm gonna put the end of this on my adapter, and I'm going to use my 4x4, and I'm gonna flush it through. All right, now that it is flushed, I'm gonna take this and then my other 4x4 sterile, and I'm gonna put this on the medication blue port over here. So I'm gonna use my sterile 4x4, take that ending that is on there off. I'm gonna put it on here, and then I am going to prime it to the end. All right, now that is primed, I'm going to take off my flush, and both of these 4x4s that are dirty, I'm going to throw them away. Next thing I'm gonna do is take my sterile 4x4, grab my lipid tubing. So I have my tubing here that is sterile for the lipids. I'm gonna connect my lipids to that right here, and I'm gonna use a sterile 4x4 right here to prime it all the way to the end. Once I get it primed all the way to the end, I am going to take that ending. I'm gonna put this down for just a second, and I'm gonna grab another 4x4 and grab that ending of the white part of the sterile TPN where the lipids go, and this is still sterile. I'm gonna take the ending off of that, take it off. I'm gonna connect this. All right, and then with another one, I'm gonna prime this all the way to the end. All right, now that's all the way to the end. I am all the way primed. I'm gonna be very careful to not touch anything else and throw away all of my used 4x4s. Now I'm gonna get ready to connect to the baby. So I'm gonna take a 4x4 and disconnect over here where my baby is currently connected to the old TPN. I'm gonna disconnect that. All right, so now I am holding over here, And with my Sterile 4x4, I'm taking a alcohol. I'm going to clean for 15 seconds. And then I'm going to throw that away. I'm going to let that dry. And then I'm going to take another Sterile 4x4, grab my new TPN, and then I'm going to connect the two. Once I have made that connection, now I no longer have to worry about everything being sterile because I can make the connection. Now I'm going to change out my cassettes, and I'm going to press start, making sure that all of the settings are correct. I'm also going to label my tubing. I'm going to take my lipids and put them in the syringe pump and program my syringe pump correctly. My second RN is going to verify everything behind me. I'm going to press start. I'm going to clean up my mess, and I can ask the family to come back in. And I believe that that is everything. All right, thanks guys.